Legislative priorities. An injured worker in the state of Washington should be able to go to any qualified, licensed medical provider and obtain medical care for the industrial injury or occupational disease that they've suffered. But presently, that is not the case. Presently, a doctor that wants to care for an injured worker has to apply to be on the Department of Labor and Industries provider list. The provider list is being managed in a way that is really designed not to ensure the highest quality of physician or practice, but it's being designed to make sure that the physicians who participate agree to ration care in the way that the department wants them to do so. Some reasons for the department's provider list make sense. For example, the department, when somebody signs up to be on the provider list, will require the physician to agree to accept the department's fee schedule for whatever procedures they're going to perform. But just because it makes sense doesn't mean it's actually necessary. And because the Industrial Insurance Act says that the sole source of payment for whatever the medical needs of the injured worker are, the sole source of that payment has to be the L&I claim, it's really immaterial whether or not the doctor has agreed in advance. By operation of law, the doctor is still limited to the department's fee schedule. So the reasons that the department will often give for why the provider list needs to be maintained, those reasons don't really hold. And when you look at it, what's functionally being done is the department is using its list as a shield and as a sword to kill doctors who would provide too much advocacy on behalf of the injured workers they treat, and to defend itself against claims where, for example, the department doesn't want to pay for a fusion surgery. That's a classic example. The department attacks the physician recommending the fusion. The department defends against the injured worker's claim and says, hey, you can't have it because the doctor's not on my provider list, or the doctor hasn't agreed to see the medical issues in question in exactly the same philosophical viewpoint as I bring to the table as the Department of Labor and Industries. So the result is we're getting actually lesser quality care delivered to injured workers, and we're making it very hard for injured workers to find medical care providers, especially if those medical care providers operate outside of Washington State's geography. It may shock some to know, even if you're in Alabama trying to care for a Washington injured worker, you still have to be on Washington's list. And it can mean that a lot of people don't have access to care when they should, or don't have ready access to care when they should. So in order to change this terrible set of circumstances, we've got to get away from this notion that the department can maintain out of self-interest a provider list, and only if you're on the provider list do you get to care for injured workers. Instead, we've got to transition to a notion that if you are licensed to practice medicine in Washington State or in Alabama, if you're providing the services in Alabama, the licensure to practice within your particular specialty is prima facie, meaning on its face, a sufficient requirement or credentialing to allow you to treat the injured worker. Now, to the extent the department might complain, well, wait, we can't monitor or enforce quality measures if we allow just any licensed practicing neurosurgeon to practice on our injured workers. Well, the argument is, first of all, as dumb as it sounds. And second of all, look, the private market, attorneys like myself, are really your main enforcement mechanism. If the doctor goes outside of the standard of practice, the high standard of practice that applies, if the doctor abuses the duty of care toward the injured worker that they would have toward anyone else, there's going to be somebody with, one of those law degrees that's willing to step up and sue them out of the ability to practice at all. That's the remedy. That's the only proper remedy we should, permit, because at this point, we've got a Department of Labor and Industries that is acting in its self-interest to ration care and deny people the free choice of interacting with their physician and deciding what is the proper standard going forward. Please join me to change our system. It should be a legislative priority in Washington State that if you're licensed to practice medicine, you are therefore qualified to provide services to injured workers. Thank you.